Okay, getting pregnant for many women is not an issue, but for others, it's not easy to start a family.
That's right, especially nowadays. And experienced Dr. Lara Oboler, founder of PregPrep and mother of 3, went through herself. So this really, good morning and welcome. Let me welcome you first.
Congratulations.
Thank you very much. But this really stemmed from your own personal experience.
Yes.
Can you tell us about that?
Sure. So I was young, healthy, ready to get pregnant, assumed I'd get pregnant for a shot. And I tried a few months, wasn't happening, and I started doing a little research. And I read about something called mucolytics, which thin out the mucus in your body. The main barrier between a sperm and an egg is cervical mucus. So if you thin that out, the sperm can get to the egg easier.
Better chances you're going to get pregnant.
Exactly. And actually, a sperm swimming to an egg is analogous to a person swimming from LA to Tahiti. So it's a long swim.
Really?
Yeah, it takes a long time. So I tried it, and it worked first time. And then for my subsequent 2 children, worked first time.
So is that what PregPrep is?
PregPrep is actually a company, and we've devised this natural, healthy, safe kit, and one of the components is the mucolytic. There are a couple other things in there to help boost your conception.
Is this vitamins? Is it a system? Do you take specific days and all that?
It's a great question. It's actually a program. Okay. And it has 3 parts. The first is a prenatal vitamin. The second part is you take it only for 5 days leading up to ovulation, and that's the mucolytic part. And then we also give you a tool to relax, because as you know, relaxation can really help boost your fertility. So when people tell you to relax, it doesn't necessarily make you relax, but we wanted to give women a tool to relax.
Before we get into specific vitamins, how much money could this save somebody? Because don't people spend thousands and thousands of dollars to get pregnant?
They do. This is a $40 kit for a 2-month supply.
Wow.
We really wanted to make it accessible to women all over the United States.
And accessibility, is it you just order online?
We have a website. Yes, it actually is. It's on our website, PregPrep.com. And actually on our website you can see the list of stores. We have local New York stores that it's in, and a couple others in the country. And we also sell in a couple different online venues, but PregPrep.com, you can get all that information.
Okay, you talk about vitamins, so some specifics. Why is folic acid so important?
Excellent question. So folic acid is the most important vitamin to have before you conceive. The CDC recommends that you have folic acid for at least a month before conception. Folic acid has been shown to decrease birth defects. So most birth defects happen in week 3 or 4 of pregnancy. You really want the folic acid in your system before you get pregnant.
Okay, so let's talk about the naturally compound.
The compound, yes, it's a mouthful. I'll say it.
Yes.
It's called N-acetylcysteine.
And it helps to boost the immunity, right?
Well, it actually is the mucolytic that we talked about. It thins out the mucus, and it's also an antioxidant, so it rids the body of toxins. And it's been studied in many studies. It's healthy, it's very safe, it's natural, and that's really our main component of the kit.
Your focus, you're a cardiologist.
Yes.
So you got a lot of heart. But so I don't want to ask too many specifics, but how important do you think, or how much of a role is age playing into the problem some women are finding in getting pregnant?
So, you know, it's really important to be aware of timetables. There are studies that show that women in their mid-20s have a 20 to 25% chance of getting pregnant per month. When you reach your mid-30s, it goes down to 15%. And when you're 40, it's less than 5%. So, you know, age really is a huge factor in getting pregnant.
Why is that? Because I know that science, there's all the variables and everything, but, you know, the recipe for making a baby, it seems pretty straightforward, right? So why are the numbers so low?
What happens is you are born with all of the eggs you will ever have for your whole life. You actually have them when you're born. And throughout the years, they disintegrate and they die. And your good eggs are fewer and fewer as you get older. So that's really the main problem.
Well, then what's your take on, you see these celebrities that are older, 40, 42, 43, 44, having babies.
Right.
I mean, great, we're happy for them, but does it send kind of a mixed message?
I think it does. I think you have to be aware that age really does play a role. To get pregnant after 40, as I said, a 5% chance or less than 5% chance, it's really tough, and you just have to keep that in mind. So if you are in a situation and you're ready to get pregnant, my recommendation is to do it earlier rather than later.
How long do you, I mean, I hate to put you on the spot, but
it's fine.
how long do you give this? How, I mean, how, couple of months?
So this is a 2-month supply, and the recommendation is if you've been trying for 6 months and are not successful, you should probably see a specialist.
Okay.
Okay.
This was a lot of info.
I know it. Dr. Lara Oboler, thank you so much
Thank you
for being
so much.
here.
I appreciate it.
For more information on improving your chances of having a family, visit PregPrep.com. Thank you so much.
Thank you.